Medventure Dr. Andrews Academy. I welcome you all for HAAD Crash Course English. We'll start with general pharmacology. First question, what is the best time to do lithium levels after the dose is administered? So you all know what lithium is. It's one of the best drugs that we give for bipolar disorder, that is a disorder where you have both mania and depression episode. But the problem with lithium is there are chances of drug toxicity, like if you take it with thiazides or if you have hyponatremia, you have a chance of having lithium toxicity. So we take the lithium level to know the levels of serum lithium, and then we decide on whether we need to increase the dose or decrease the dose. The answer is 12 hours. 12-hour trough level is preferred, but in some circumstances, like if there's a 3 times a day dosing or there's a limited lab hours, then it can be drawn between 8 to 12 hours post-dose. Next question, what's the total maximum daily dose of over-the-counter paracetamol? So paracetamol is an analgesic that we usually use over-the-counter. It does not need any prescription. But even though paracetamol OTC drug has got a limit, okay, beyond that you're not supposed to use. So if you have paracetamol, if you take beyond it, what happens? You'll have paracetamol overdose or acetaminophen overdose, and it can cause hepatotoxicity. So when you're taking it as OTC drug, the limit is 4 gram. Maximum daily dose is 4 gram or 4000 mg. If you're an adult, you can take 500 mg tablet 4 times in 24 hours, and you must wait at least 4 hours between the doses. So totally you can take about 500 mg tablets 4 times in a day, but then you have to wait at least 4 hours between the doses. Do not take more than 8 tablets in 24 hours. Moving on, in a hemodynamically stable patient, when it is recommended to draw gentamicin trough level. So we first looked into lithium trough level. Now we are seeing gentamicin trough level. So gentamicin, as you all know, is an aminoglycoside and it needs monitoring, okay, because aminoglycoside overdose can cause ototoxicity, nephrotoxicity, and ototoxicity is one of the irreversible side effects of gentamicin overdose or aminoglycoside overdose. So trough level of gentamicin should be taken at steady state before the 4th dose. Okay, unless there is a renal dysfunction or toxicity suspected, obtain the drug level after the 3rd dose or before the 4th dose. Which one of the following medication is known to be a powerful enzyme inducer? Now talking about enzyme inducers and enzyme inhibitors, okay, we have a list of enzyme inducers and inhibitors here. Inducers include carbamazepine, barbiturates, phenytoin, rifampin, rhizoflavin, St. John's wort, cyclophosphamide, and inhibitors include amiodarone, cimetidine, fluoroquinolones, clarithromycin, azole antifungal, grapefruit juice, isoniazid, and ritonavir. So what is the difference between an enzyme inducer and enzyme inhibitor? Enzyme inducers, from the name itself, it indicates that this induces the metabolism of the other drugs. So when you take an enzyme inducer and along with it you take another drug, what happens? The enzyme inducer induces the metabolism of the other drug. So what happens? The metabolism is increased and it has to get out of the body as soon as possible. It cannot stay and do its action. So when you take a normal drug with an enzyme inducer, because of the enhanced metabolism, it cannot stay in the body and do its action properly. Okay, so you'll have less therapeutic effect. Whereas if you take an enzyme inhibitor, the opposite happens. It inhibits the metabolism of the other drug. So when you take an enzyme inhibitor along with another drug, a normal drug, it inhibits the metabolism of the other drug, and what happens? It cannot get out of the body. It stays in the body and it gets accumulated, causes toxicity, increases side effects. Okay. So coming back to the question, which is the known powerful enzyme inducer? So from the list we can choose rifampicin, warfarin, itraconazole, metronidazole. These are all enzyme inhibitors. Itraconazole, metronidazole especially. Warfarin, if you take with an enzyme inhibitor, what happens? You will have reduce inhibition of warfarin and INR will be high and you'll have bleeding. Whereas if you take a prodrug with an enzyme inhibitor and inducer, the scenario is different. You all know how prodrugs work. Prodrugs needs to be metabolized to its active compound to show its action. Talking about clopidogrel, it's a prodrug and it needs to get converted into an active metabolite for its anticoagulation. So if you take it with an enzyme inducer, this metabolism gets induced or enhanced, and it fastly gets converted to its active metabolite, and it can effectively show its action. Okay, but again, if you take it with an enzyme inhibitor, the opposite happens. If it's a prodrug, the inhibition of metabolism, or when the metabolism is inhibited, what happens? It cannot get converted to its active metabolite and it cannot show its action. Moving on, women comes to you with a daughter that is suffering from head lice. She already had been treated with insecticide before, but it returned. What is the appropriate response? So she came with her daughter and she was suffering from head lice. So she informed that she already tried taking insecticide before. So when you look into the guidelines, or when you look into the how lice has to be treated, you have certain guidelines. According to CDC, permethrin is the first choice, the first pharmacological or insecticide that we usually prefer. But again, one application of permethrin or one-time application of permethrin is not going to be very helpful. According to CDC guidelines, you need multiple application of permethrin to show its action. So here she's already been treated maybe once. Okay, so give permethrin is the right choice here. It's a safe and effective insecticide when it is used as directed. Permethrin can kill the live lice but not unhatched eggs. Permethrin can continue to kill newly hatched lice for several days after treatment. So once you use, next day you can't tell that your lice hasn't gone. It takes a few days. A second treatment often is necessary on the day 9 to kill any newly hatched lice before they can produce new eggs. Moving on, in clinical trials, what is the acceptable power of study? So whenever you do clinical trials, there's a term called power of study. So the ideal power of any study is considered to be 80% and above. So in our option, we have option A as 85. So that's the right answer. So power of study, it's nothing but it's the probability of finding a difference that exists in a population. The probability of finding a difference. So whenever you do a study, there will be a population and there will be a difference existing. So the probability of finding that difference is termed as power of study. It depends on the chosen level of significance. So before you start a study, you'll set a level of significance. Okay, so that the power of study will depend on the level of significance, difference that we look for, the effect size, and variability of the measured variables and sample size. All of these factors affect or influence power of study. It is the probability of rejecting a null hypothesis, false null hypothesis, and finding what the researcher wants to find. So when you start a study, the researchers will set a null hypothesis. Okay, so the probability of rejecting that null hypothesis and finding what the researcher wants to find is the power of study. It's usually set up at 80%. What it means is that if there are true effects to be found in 100 different studies, totally you have 100 different studies, and you need to find the true effects in that 100 different studies with 80% power, it means that only 80 out of 100 statistical tests will actually detect them. What is the effect of smoking on serum olanzapine level? So serum olanzapine and smoking. Olanzapine is an antipsychotic drug. Moreover, it's an atypical antipsychotic drug. When you learn about the typical or atypical antipsychotic drug, the first thing you have to know is the typical ones are the most potent as antipsychotic drugs, and it has got serious side effects like hyperprolactinemia and extrapyramidal side effects. When you compare it with the atypical antipsychotic, mostly atypical antipsychotics are associated with metabolic side effects like weight gain and diabetes mellitus. So when you consider olanzapine, it has a serious side effect called agranulocytosis. Okay, so before you start olanzapine therapy, a baseline neutrophil count is very important to do. It should be the baseline should be at least 15,000 U per ml before you start olanzapine. Coming back, so when you give an olanzapine to a smoker, there will be some difference when you give it to another normal person, because smoking is a CYP1822 enzyme inducer, and olanzapine is metabolized by the same enzyme. So as I told you before, when you take a drug with an enzyme inducer, what happens? The drug gets metabolized faster and the metabolism is enhanced, and what happens? It gets out of the body fast, so it can't stay and do its action properly. Similarly, when you take olanzapine and when you smoke at the same time, what happens? Smoking, being an enzyme inducer, induces the metabolism of olanzapine, and the olanzapine can't stay in your body so much, it gets out. and what happens, the antipsychotic effect cannot be achieved. So because the smoking will decrease serum olanzapine level. What does high volume of distribution indicate? So high volume of distribution means the drug accumulates in the tissue. So this is how it goes. The drug, if it's in the plasma, it gets into the body tissues. The plasma and body tissues. That's how the drug goes. Okay, so after absorption, the drug enters the systemic circulation and then it gets into the different body tissues. That's how the process is. If the volume of distribution of a drug is high, it means that from the blood it goes, more amount of that drug goes into the tissues, and in the blood it will be only a very few amount of drug. But if the volume of distribution is low, it means that very few amount of drug goes into the body tissue and most of the drug is staying in the systemic circulation or in the plasma. Okay, so high volume of distribution means most of the drug is in the tissues and very little in the plasma circulation, and larger the volume of distribution, the more likely that the drug is found in the tissues of the bodies, and smaller the volume of distribution means the drug is confined to the circulatory system. Which route of administration results in faster absorption? So the route of administration plays a very big role in the rate of absorption. Okay, so as you all know, IV route is the fastest route of administration. That's why when in an emergency condition we give IV and we prefer IV rather than any route, and also it has got 100% bioavailability because it does not undergo absorption. Okay, so another route is rectal route. So we have rectal, oral, topical and subcutaneous. So among these options, the rectal route is the fastest absorption, and as I have also given you the list of routes and the time it takes until effect. IV, as I told you, takes the fastest route, that is 30 to 60 seconds. Intraosseous, same. Endotracheal takes about 2 to 3 minutes. Inhalation takes about 2 to 3 minutes. Sublingual takes about 2 to 5 minutes. Intramuscular takes about 10 to 20 minutes. Subcutaneous 15 to 30 minutes. Rectal takes only about 5 to 30 minutes. So why does rectal takes only very few minutes? It's because of the rectal wall. It's very thin and the blood supply to that area is very rich. Okay, so absorption, there are several factors that affects the absorption of a drug. One of the factor is the blood supply, blood perfusion. As it increases, the rate of absorption also increases. Next, we have oral route. It's one of the slowest route. It takes about 40 to 90 minutes for its effect. And transdermal, it's variable. It varies from minute to hours. Drugs with pKa is equal to 5. Absorption site is. So if a drug is having a pKa of 5, it means that the drug is weakly acidic. Okay, so a drug that is acidic is more likely to get absorbed in the acidic areas of the proximal duodenum, whereas the basic drug will get absorbed more in the alkaline areas of the distal ileum. So the proximal duodenum is slightly acidic and the distal ileum is slightly basic. So the basic drug gets accumulated in the distal ileum and the acidic drug gets accumulated in the proximal duodenum. So all of you know, now in this world there are mostly basic drugs. Okay, mostly there are basic drugs and there are also acidic drugs. So acidic drugs gets accumulated in the stomach more because the stomach pH is more acidic. As you can see in the image, stomach pH is only about 1 to 3. So most of the neutral and acidic drugs get accumulated or absorbed in your stomach. Whereas, as you can see, the small intestine, the pH is 5 to 7.5. So most of the drugs are basic, and so most of the drugs absorption takes place in small intestine. There are also different pH as you can see in the image. Your mouth has got about pH of 6.8, and most of the neutral and basic drug absorption can happen there. Liver is the primary site for metabolism, and then you have large intestine with pH of 6.8 and less amount of drugs get accumulated there. Rectum 6 to 8, small surface area only. So drugs with any pH can get absorbed, but to a lesser extent. Moving on, the way permethrin works is by overexciting an insect's nervous system. When an insect encounters permethrin, it becomes paralyzed, and in this weakened state, the insect generally disengages, falls off, and frequently dies. What is the reason of death? So it's basically asking you the mechanism of action of permethrin. Answer is makes respiratory paralysis leading to death. So permethrin causes respiratory paralysis for the lice, and that is the reason of death. So permethrin is a synthetic neurotoxic pyrethroid class of medicine, and it targets eggs, lice and mites while working on sodium transport across the neuronal membranes in arthropod, causing depolarization. And because of this depolarization, it will result in respiratory paralysis of this insect.